The much-awaited training orders for COVID-19 are finally here, so we're going to talk about them today. But before we get started, I want to highlight 3 points. These 3 points are what is approved for people to get the new formulation of COVID-19. These are the 3 points I really want you to remember. So we're going to be highlighting them multiple times throughout training so that you can remember them. Number 1, anyone who has not had a previous 2023 and 24 formulation of a COVID-19 is able to be vaccinated. Let me say that one more time. Any patient who comes to you who has never had the new formulation, the 2023-24 formulation, is able to be vaccinated today. They are then considered fully vaccinated. Number 2, children 6 months to 4 years old who have never been previously vaccinated with a COVID-19 vaccine should receive 2 doses of Moderna 2023-2024 formulation. And number 3, anyone who is immunocompromised should be receiving 3 doses of a COVID-19 vaccination. One of those doses should be the new formulation, the 2023-2024 formulation. Okay, we'll circle back to those throughout this training, but let's get started. We're gonna look right at our orders. So let's start with our orders right up at the top. Of course, every order has purpose and policy. We're gonna skip over those and jump right into that procedure. Our number 1 bullet point is to always assess individuals to make sure that they are allowed to be vaccinated. So let's run through these really quickly. Anyone who is 6 months and older and healthy is able to be vaccinated. Anyone who is currently healthy but may have a chronic medical condition, they are also able to be vaccinated. Anyone who is immunocompromised may be vaccinated today, but they need to be educated to continue with precautions by the CDC to protect themselves. And also realize that there is a potential for a reduced immune response. Anyone who is pregnant or lactating should also be vaccinated. There is no contraindications for pregnancy or lactation. A person who is receiving any other vaccine today can also be vaccinated, so you can co-administer 2 vaccines, making sure they're 1 inch apart or in separate arms. Okay, so you may co-administer vaccines. Okay, let's jump into precautions and contraindications. Let's start with contraindications. Anyone who has had a previous allergic reaction after a COVID-19 vaccine should not be vaccinated, okay? Anyone who has had a serious allergic reaction after a previous COVID-19 vaccine should not be vaccinated. In addition, anyone who has an immediate, meaning within 4 hours, allergic reaction of any severity to a previous dose of an mRNA vaccine should actually be receiving a different presentation. So rather than receiving an mRNA, they should receive Novavax. Because we do not provide Novavax at our sites, we are going to refer them to an allergist or an immunologist so that they can see a better scope of the options that they have presented to them. I want you to note when we are talking about an immediate allergic reaction, we are not referring to pain at the site, swelling, redness, or anything to do with lymph nodes. Do not consider that part of that immediate allergic reaction. Those are very common symptoms for any vaccination. If one of those symptoms is present, it is okay to vaccinate. It is not considered a contraindication. Moving on to bullet point number 2. Do not give a person who has developed myocarditis or pericarditis, here's the key, within 3 weeks after a previous dose of COVID-19, okay? So if a patient comes to you and they had myocarditis or pericarditis before their vaccination, you can vaccinate. If a patient presents and they had myocarditis or pericarditis 3 weeks after their COVID-19 dose, you can vaccinate. The contraindication here is within. So if a patient developed myocarditis or pericarditis within 3 weeks of a previous COVID-19 vaccination, you cannot vaccinate. Okay? Moving on to our last bullet point. Do not give a person who was previously ill with COVID-19 and had the multi-system inflammatory system. Do not vaccinate. Okay? You will refer them to their primary care provider. There are times when those who have had that multi-inflammatory syndrome are able to be vaccinated, but at Homeland Health Specialists, we will not be vaccinating this population. You must refer them to their primary care provider to find out what their next steps are and how they can proceed with COVID-19 vaccination. Let's talk about precautions. For anyone who presents to you who is moderately or severely ill, with or without fever, they should defer their vaccination until they have fully recovered from their illness. If someone presents to you with COVID-19, you will refer them to CDC's guidelines for quarantining after illness. They will need to be deferred for 5 days after symptom onset and until symptoms have improved. For those who are asymptomatic, they will need to quarantine for 5 days, and then after their first negative COVID test, they will be able to be vaccinated. Moving on to that last bullet point, anyone who has not received a COVID-19 vaccine in the past, but has a history of anaphylaxis after any other vaccine or any other injectable therapy, cannot be vaccinated today. Instead, we will refer them to their primary care provider for follow-up and directions on how to proceed with their COVID-19 vaccination. Let's talk about preparation for administration. In our standing orders, there's a chart indicating what type of needle should be used based on the patient that you have. For anyone who is under 3 years old, you will be using a 1-inch needle, a gauge of 22 to 25, and vaccinating in the thigh. For anyone who is 3 years old and older, you will choose a needle based on their size. For most participants, you will use a 1-inch needle. For participants who are quite smaller, such as children or the very elderly who are frail, you'll use a 5/8. And those who are quite larger, who have a lot of fatty tissue, you'll need to use a 1.5 inch to get through that fatty tissue into their muscle. The gauge is 22 to 25, and you will always be vaccinating in the arm or in that deltoid muscle. Right under that chart, it then talks about our Moderna vaccination presentation. Each of the presentations comes in a single dose vial. The contents within that vial are a white to off-white opaque suspension. There is no preservative in these vials. These vials must be thawed prior to administration. If by chance you get a frozen vaccine, you'll need to set it out at room temperature for 15 minutes for it to thaw, or you can hold it within your hand to help warm it up. There are 2 presentations of this vaccine. Moderna 6 months to 11 years old, containing a 0.25 dose. It comes with a blue cap and a green label. The Spikevax 12 years and older contains a 0.5 milliliter dose. It comes with a blue cap and a blue label. Prior to administration, you are going to gently swirl these vials to ensure that everything is mixed appropriately. Then you can drop the dose for administration. Do not shake these vials, as it can cause damage to the vaccine. This vaccine does not need to be diluted. Let me say that one more time. This vaccine does not need to be diluted. Let's talk about administering vaccine. This is what we talked about at the very beginning and what I really want you to take home and remember as you go to clinics. This is huge. So let's do it again and go in a little bit more detail. So let's read this together. Our standing orders for assessing individuals 6 months and older for a COVID-19 vaccine. The Moderna COVID-19 vaccine 2023-2024 formula is a single dose for all individuals 5 years and older who have not yet received the 2023 formula. This is where 90% of your patients will sit. Okay, so let's read that one more time. The Moderna COVID-19 vaccine 23-24 formula is a single dose for all individuals 5 years and older who have not received the 23-24 formula. Any individual who is 6 months to 4 years old who have not ever been vaccinated should receive 2 doses of Moderna, the 23-24 formula. For immunocompromised individuals, they should have at least 3 doses. One of those doses should be the new formula, the 23-24 formula. So let's look at this chart a little bit. Please note that as I read through this chart, I am going to be referring to those footnotes. So if I'm reading something that you're not quite following, know that I am referring to the footnotes. So individuals 6 months and older who have never received Moderna or Pfizer COVID-19 vaccine 23-24 formula, and it has been at least 8 weeks or more since their previous COVID-19 vaccine, may be vaccinated today. When we're talking about that previous COVID-19 vaccine, we're referring to the original monovalent or bivalent of mRNA. We're referring to Janssen as well as Novavax. Those original monovalents and bivalents are no longer authorized within the United States for use. Okay, so that's what we're discussing, or that's what we mean when we talk about a previous COVID-19 vaccine. Okay, now we're going to look at subnotes 2 and 3. Any healthy individual who has received one COVID-19 vaccine has completed their series. So let's read that again. A healthy individual 5 years and older who has received one 23-24 COVID-19 vaccine has completed their series. Okay, so they do not need a second dose or a third dose. They only need the one vaccine. Even if this is their first ever COVID-19 vaccine, they only need one dose. All right, number 3, healthy individuals 6 months and older who have completed at least one previous Moderna vaccination or 2 previous Pfizer vaccinations and then received a COVID-19 2023-2024 vaccine are considered up to date. Okay? All right, number 6, all doses for individuals 6 months to 4 years old and immunocompromised need to be from the same manufacturer, meaning if they received Moderna or Spikevax, they're the same vaccine. They received Moderna prior, they need to receive Moderna now. Again, this is only for children 6 months to 4 years old and the immunocompromised. If they received Pfizer before, they need to receive Pfizer again. Now, there are situations when there are exceptions. For example, the same vaccine is not available, a previous dose is unknown, they would not complete the series otherwise, or it is due to a contraindication. So there are several exceptions to this. When an exception happens, document it on your consent form or within primary bio. You will probably encounter several of these exceptions. Okay, and then let's go back up to the top. So we've fully covered that first line. That first line is going to be the majority of your patients. So anyone who has not yet had that new formulation needs to get a dose. So anyone who has not yet had the new vaccine gets one dose. Okay, so let's talk about some of the exceptions. Individuals, so we're on line 2, individuals aged 6 months to 4 years old who have never received a previous COVID-19 vaccination and have only received one Moderna COVID-19 2023-2024 formula, and that dose was 4 weeks ago, they are able to get vaccinated. Okay, so this is that scenario where Someone who has never been vaccinated should be receiving 2 doses if they're 6 months to 4 years old. So if they're in that 6 months to 4 years old range, they should be receiving 2 doses. So this second line is for those individuals who have already had that first dose of the new formulation and they need that second dose. That is what this line is indicating. There needs to be at least 4 weeks between the 2 doses, okay? Let's look at footnote number 5. Any of the children who transition from age 4 to 5 during that 2-dose series should still receive 2 doses of Moderna COVID-19 23-24 formula, okay? So they should still receive those 2 doses even though they changed ages within receiving that series, okay? All right. And then one other piece is it highlights 4 weeks. So let's go down to footnote number 7. At times there should be, we can encourage an 8-week interval instead of 4 weeks. That 8-week interval between that first and second dose might be optimal for some people as it reduces the risk of myocarditis and pericarditis. These risks are actually very small, especially as more and more studies come out, but it does happen. So we could encourage that 4 weeks to be lengthened to 8 weeks. Okay, we've talked about the 6 months to 4-year-old, so let's move down to that immunocompromised individual. Okay, so immunocompromised individuals should have 3 total doses of COVID-19 vaccines, with at least one of them being the new formulation. Each dose must be separated by 4 weeks. So let's talk about immunocompromised individuals under number 4. People can self-attest to their moderate or severely immunocompromised status. We don't have to have a doctor's note. We don't have to inquire about what specifically their disease is that is considered immunocompromised. They can say they're immunocompromised and we will vaccinate. Okay, so back up to that third line. Immunocompromised individuals should have a total of 3 doses. Let's go down to number 8. So it is possible that they may get another dose of the new vaccine. So immunocompromised individuals 6 months and older who have received 3 mRNA vaccines, including 1 dose of the new formulation, may receive 1 additional dose of Moderna 8 weeks from their last dose, okay? So they could get another dose. Any further or additional doses beyond that, they need to go to their primary care provider, and they will help them figure out their next steps in their COVID-19 vaccination series. If you have somebody come who has had 3, 4, 5, 6 prior COVID-19 vaccinations, but they've never had the new formulation, they fall into the first category, okay? They fall into that first category because they have never received the new dose. Everybody qualifies for at least 1 new dose, okay? Everybody qualifies for the new dose. So I know this is a lot. I would really like you to take time, read over this particular section, dig in, and know these orders a little bit more before you go to your first clinic. The last part of these orders talk about documentation that you need to give out. So your COVID card, you're going to sign their consent forms. You're going to always provide a VIS. Those will be available on the registrar table or within Primary Bio. Those are always made available when they sign up online with Primary Bio. So you do not need to physically give them a piece of paper every single time. It just needs to be made available to them. Always be prepared for emergencies and know that we will be reporting incidents to VAERS as needed. Copies of these orders are available within the office, and we have the actual signed orders in our office as well.